Hi, I'm Brian Cott. I'm an upper extremity surgeon with Brielle Orthopedics. The biceps tendon is a tendon that goes from the upper arm to the level of the forearm. The biceps tendon goes to the radius bone, and what the biceps tendon does is it works on bending your elbow and turning your elbow so the palm is up. The biceps tendon is also the show muscle when you flex your arm. The biceps tendon can sustain a rupture. This typically happens when you're lifting something very heavy, or there's a sudden downward force to your arm as you're lifting a heavy object. A biceps tendon rupture can either be proximal, which is up by the level of your shoulder, or distal, which is in the level of your forearm. Common symptoms of a distal biceps tendon rupture are swelling, bruising in the level of the upper arm, and also weakness when trying to flex the elbow. Another sign of a distal biceps tendon rupture is the tendon may ball up in the arm and a visible cosmetic deformity is noted. Biceps tendon ruptures are usually diagnosed clinically. Usually the deformity in the level of the arm, the bruising, and the history are enough to make the diagnosis. Sometimes, in order to make the diagnosis, an MRI will be ordered. X-rays may be taken, but are usually negative, as a tendon rupture will not present itself on a standard X-ray. An MRI may be ordered, which will show the biceps tendon rupture. Distal biceps tendon injuries can be either treated with surgery or non-operatively, depending on your age, your activity level, and your ultimate outcome and goals. Different options can be considered. The non-operative approach is usually using a sling for several weeks, followed by some physical therapy exercises. The tendon normally is under tension and will not grow back to the bone. There'll be a small cosmetic deformity and slight weakness in turning your palm up and also in flexing your elbow. Another option is surgical procedure. This can either be done through a 1-incision or 2-incision technique. Typically, I'll do this through a 1-incision technique made just beyond the level of the elbow flexion crease. The tendon will be found and attached to the level of the bone. There are a variety of ways to anchor the tendon to the bone, but I use a technique called an endo button. The endo button technique involves making a hole through the bone. An anchor is placed on the far side of the bone, and the tendon is pulled into the hole created into the radius bone. Post-operatively, early motion can be begun. Typical range of motion is obtained within approximately 6 weeks, and physical therapy can last roughly 3 months. It can take roughly 6 months to 1 year to regain normal motion of the upper arm. There are risks, however, with surgery. Getting an infection, injuring nerves and tendons, and re-rupture can all occur. Rehabilitation exercises can start as early as 1 to 2 weeks after the procedure. Strengthening exercises can start as early as 6 weeks after the procedure. And it's very common for people to be able to return to heavy lifting after having completed their rehabilitation course.